Okay.
Thank you.
Also, we can't
Okay.
hear the dogs. I at least can't hear them.
Well, they ran outside, so but when they do come back, I do apologize if you do hear them. So our theme for this month is communication literacy. And it was actually due to the availability of our speakers, we had to swap things around a little bit. And I have to confess, this is very last minute. So I would really appreciate your input and your thoughts and your, being part of the discussion would be really great. Um, so today we're going to talk about from words to action, the importance of communication literacy in professional practice. Um, and this is literally just going to be an overview of what communication literacy is all about. And we're going to explore some of the concepts related to communication literacy. So first things first, I want you to find an image or anything on your desk or around you or where you are at um, that you think is representing your understanding of communication literacy. So find anything you can look online for a meme or a GIF or a image or a picture, or if you've got something, what do you think does communication literacy mean? And you can share it on the chat. You can put your video on and show it to us if you want to. Yeah, so just share an image that shows your understanding or represents your understanding of communication literacy.
Yes.
If you don't want to have an image, if you want to have one word, then you can have one word that you can also add to the chat if that's going to be easier to save some time. But yeah, I'm going to give you a few minutes to add to the conversation or the chat.
Yes. Yes.
Ooh, that looks interesting, Christine.
Um, Honestly, communication was never my strong suit. Um, so it always feels like I'm juggling a lot of things with just two hands.
Okay.
Yes. 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 Yes.
Sue, I saw a flickering. I don't know if you are wanting to show your camera and have something up there. Oh, you've got your cell phone. Okay. Aviva has got, wow, visual,
Yes.
lots of things happening in that image.
Yes.
Okay, so we've got one or two, or three images. Stuart, thank you. What have you got on yours? That's also interesting. So let's try and unpack what we think is the understanding of or the relevance or the relation between the image and the understanding of communication literacy. So I'm going to start with Vesna. You have added kindness um, or kitness.
Yes.
Do you want to elaborate on what is your understanding of how does that relate? What is the relation between your word and your understanding of communication literacy?
Yes. Yes. Yes.
Yeah, Lizelle, sorry for delays. I'm working from my parking office because, as you know, we don't have offices. So
Shh,
the internet is also messing me around, you know, and
not a
I might
problem.
have a pigeons interfering, you see. So to me, communication literacy is something that comes from environment also, but it comes from your heart. It depends how you want to communicate. I find it that through many experiences that I experienced as a chair of transformation in the last 4 years, I have experienced that if you're kind,
Yes.
then communication becomes much better and it flows and people exchange ideas and much of a good comes out, you see. But
Great.
if the people are not kind and they don't they let's say I'll take myself as example. If there is person that scares me, and Shira knows who is that. I'm involving Shira here. You know, I am going to be in the state of fear. So
Okay.
I cannot communicate. And my communication literacy is going to be totally off. It's not going
Ah,
to be me. It will be someone who is in the state of fear. So through transformation, I found out that if the people want to communicate properly, they have to have from both sides relaxed situation where they all feel safe. So to me, this is how I'm understanding, and this is what I've seen. So that's why I've joined today's lecture also because I want to learn from you. I
great.
think most of the time people also get overcrowded with information. If it is two people, it depends on what kindness they have in their heart. If they don't have in that moment kindness, they will not have a communication. Because to me, if you cannot be kind to each other and professional, then you cannot basically um, communicate. And therefore, you can't have a communication literacy with you. You are not presenting what you are. If there's a group of people and there's always secularization where there's 10% of those ones who basically know just one way of communication and that's in their own little group, then the rest of the 90% of the group will start losing out and pinching the kindness and whatever they were planning to do that day will not come out as communication literacy. So for me, I see a big problem in this area. And I would like us to emerge in the future into more kinder professional environment. And I believe that if we push in that direction, for instance, communication literacy will become on much higher level for all of us. But it
Thank
all depends in what state you are, Lizelle,
Okay. I hear you, and thank you so much for that explanation of how you see kindness linking up with communication literacy. I am going to ask Aviva to also thank you, Shira, for putting your explanation with your picture to saying welcomed, valued, heard, and accepted. I really appreciate that. That's very valuable. Aviva, you're linking to your image?
Oh my goodness, Lizelle. So I mean the ideas and the talk and the thoughts and the engagement around those two people kind of symbolizes the idea that we all come into a relationship or a discussion with our own ideas and inputs from various other people. Um, and the way that the two centrally are engaging with each other is with a smile and with kindness, like Vesna says. So if you bring your perspectives and your ideas with respect and kindness and open face, an open heart, that means that whatever you're discussing and whatever you're trying to convey can be accepted more easily without any prejudice, without feeling bullied or othered or anything like that. And that's what that picture really represented to me.
Thank you. I think you are all having a good understanding. You are picking up on all the buzzwords that I could find and included in my talk today. So yeah, I think I'm speaking to the converted. I'm going to have one last person, and Stuart and Sue, I'm not going to ask you because I know that you will definitely contribute to some of the conversations later on. But I'm going to pick on Chantel because that's a very interesting picture on the baby formula and the mother. So please, how do you relate that to communication literacy?
Okay, so firstly, it's World Breastfeeding Week. So putting the breastfeeding message out there. But I think the picture also represents the noise when we are communicating. Sometimes it can be aggressive, such as what is being represented with the bottle. And effective communication is actually action. And that's the mommy breastfeeding. So despite all of the noise, despite in this context, the hostility around her, she's able to extract information, apply the information, and it's it's the practice. Does it get done?
Yes.
Thank you, Chantal. And you have actually touched on some other aspects of communication that we haven't, that we will be unpacking a little bit further. But you were using your image to communicate the fact that it's breastfeeding week. As well as some related information concepts that relates to breastfeeding. So you use image or media to get your message across. And it's sometimes things that we're forgetting about when we are thinking about communication and what communication literacy means. So I went ahead and like all of us these days are drawing on AI. And I asked one of the AI generators or language models to give me a definition of communication literacy. So I've used Perplexity AI, and the definition that they've given, or what AI gave, was a skill set that encompasses effective communication abilities along with an understanding of social norms and etiquette. It emphasizes not only the ability to convey and interpret messages, but also the awareness of various communication channels, particularly in the digital age. And this includes the capacity to engage with and utilize different platforms such as social media, email, and web conferencing, while applying conventional communication principles and social etiquette in these contexts. Now, that's a mouthful. It also gave me another definition that states communication literacy is defined as the ability to communicate well with others, which includes encoding and decoding messages effectively. It extends beyond traditional literacy, which we take as reading and writing, to include digital literacy, media literacy, and the ability to engage with various forms of communication, such as interpersonal, group, and mass communication.
Yes.
This is a mouthful. Does that speak to your understanding? You can just have a thumbs up as a reaction, or to what your understanding of communication literacy is. And if it is, then it's good. But if it's not, what is new or what is different from your understanding of communication literacy?
Yes. Yes.
I
Yes.
had one thumbs up. Anybody just unmute if there was a new, if there's anything different, anything new, anything that is not.
Yes.
Okay,
Yes.
so everybody has got their thumbs up. So you are happy with this definition?
Yes.
Okay.
Sorry,
Yes,
sorry,
Chantal.
Lizelle.
Yes.
Apologies. I don't have a frog in my throat now. I do find it interesting that it hasn't translated to the action part. So we see the different engagement platforms, the varied channels, but effective communication is
Yes.
the application. So we send information. I like those pictures where there's all these bubbles, people talking, but it is about making sense. It is about applying, I think.
Okay. So if we look at it's not only the ability to convey and interpret, but also of the channel. So making sense of it, engaging with it. But you would like to have more of the action involved in them. So that's definitely a good way of adding to the definition. So please keep that in mind when we are looking further into the communication literacy. So it basically speaks to the elements of what we are, what does it involve? To summarize definitions of communication, it is effective communication, the ability to express thoughts and ideas clearly and persuasively, both verbally and in writing. So that speaks to the traditional way of communicating. Understanding social norms. So this is normally relating to your actions, your non-verbal behaviors, but also the cultures related to it. It's not just the social, what is acceptable, what do we value. So it's embodiment of the respect, the kindness, so the emotions in that. Digital literacy, navigating and utilizing digital communication tools effectively, and that brings in the mass media, the digital media, the other platforms, not just the in-person, face-to-face or written, and because there's different rules that applies when it speaks to. So and then lastly, critical thinking. It's the analyzing and evaluating the messages, and having the emotional intelligence to understand what somebody is trying to say or mean. And that's why it's sometimes so difficult when we've got images or when we are having SMSs. It's so easy to misinterpret what is being said, because we are putting our own emotions, our own state of mind to reading something, and it might not be the intention that was coming from the other person. So I like what Shira is saying there, that encoding and decoding, people are they hearing what is being said? And it's literally that critical thinking that applies to that. So communication literacy is essential for fostering successful personal and professional relationships in an increasingly interconnected and technology-driven world. It prepares us how to communicate effectively across diverse contexts and platforms, and enhancing our ability to engage meaningfully with others. And I think, Chantal, you would like to have that action. How do you respond, and how do you act as a basis of the communication? Shira, please.
Thanks, Lizelle. And I'm loving what you're saying. It really resonates with me, particularly because the whole idea of what we do as faculty developers revolves around communication in terms of helping people understand a reframing of looking at the same thing that we're all seeing, but in a different way. And I think that there are lots of ways that we can lots of channels we can use to do that. The question I want to ask everyone, though, and you, because you're facilitating, is this concept that we need to be able to use these communication channels as well as the digital literacy, et cetera, et cetera. So social media, most of you know I'm not such a fundy on social media. But the point about all of that is that there are now many, many, many ways of communicating, not just writing letters to each other or standing up and speaking to each other. And in some instances, I would say that there are people who've taken a stance that is actually hindering our next generation, that people don't know how to speak to each other because they send each other WhatsApps. So they can be sitting across a room and be communicating, yes, but not communicating through social cues and speech. And I think that's maybe something we need to think about. Is that necessary? Are we just now going to evolution ourselves out of that? And would we still value that? Because in my yes, I think we do still value that. For example, a student who very eloquently can present a case and their patient scores much better than a student who ums and ahs and looks like they don't know what they're talking about. And that's of concern because they might know exactly what they're talking about, but they just have no experience in communicating with other people face to face. So that's my question. My question is it okay just to be incredibly good at communicating through other channels and not through how we've traditionally done it?
So, Shira, I think you are, and thank you for that question, because I think and I will give my response, and I want you all to think about this, because who are we preparing? We are preparing healthcare professionals, and they need to think about this, who they are communicating with, and what is the message that they want to get across. So is using technology the only way, and is it the most appropriate way? And are we exposing our students to be able to communicate effectively, getting their message across in the various platforms? And later on, right at the end of my presentation, we will come back to how does it relate to healthcare professionals education. But I like the idea that you are sparking right from the front. Thank you, Shira. Stuart, please add to the conversation.
Yeah, good afternoon. Thanks, Lizelle. Just building on what Shira said, I was doing research with interns, so recent Wits graduates, talking about the skills they need in order to succeed in the clinical setting. And just based on what Shira said, I'd love to read you a quote from one of the participants. They said, this is for one of my focus groups, they said, even if you have all the knowledge, if you're not really confident, if you struggle to speak to your seniors, speak to people from other departments, speak to allied services, then it doesn't really translate and it becomes very difficult to do your job. Even interacting with patients, it just becomes very difficult to establish yourself. So
Yes.
there's one of our graduates talking about just how important communication skills in order to translate any of everything else they learned into something meaningful in the clinical setting, that ability to communicate.
Stuart, you are again, and I mean, this is speaking to the relevance of why we need to have a focus on communication literacy, because, and it brings me to my next slide. Thank you for that. What is the difference between communication literacy and traditional communication skills? What are we thinking of? Because we are embedding, we are teaching ways of writing. We are doing academic writing. We are using technology in how we communicate with one another. Today, we are using a digital platform to actually engage and share information, sharing ideas, and talking to one another. So we are developing skills. So I want you to look at the following slide about the definition and scope. Which one of these definitions, the left-hand side or the right-hand side, speaks to yes, literacy, communication literacy, and which one is more a definition and a scope of communication skills? So on the one side, we've got this encompasses a broad set of skills that include not only the ability to communicate effectively across various media and contexts, but also the understanding of social norms and digital communication practices. It emphasizes critical thinking and the ability to analyze and create messages in both digital and traditional formats. The other definition is focused primarily, so it's primarily on the foundational abilities to convey information through spoken and written language. This includes skills such as grammar, vocabulary, and the ability to engage in face-to-face conversations or written correspondence. Which one do you think is communication skills? Aviva?
Yes, I think
Oh, Lebo, please, just yes, start the
Lizelle,
conversation. Yes.
I think the one that's on the right of my screen that says focus primarily on the foundational abilities would then be the skills.
Okay.
Whereas the one on my left then will be the scope.
Will be the scope of that will be the competency communication literacy. And yes, that is true. So we are focusing, and thank you, Sue. You also, Sue, you're saying that on the right-hand side, that is the basic skills. And this is what we are focusing on our students. This is what we are assessing. we are assessing critical thinking differently. We don't see critical thinking as part of the communication, but in actual fact, the formulation of an argument or to negotiate or to influence somebody is part of communication, and that is a literacy that we need to, yes, we are doing it, but I think for myself, I've never categorized it within communication as such. I package it in something different. But if we are developing the way of communicating, and Stuart, I think that speaks to what the students were saying, that we don't make it explicit, or am I misinterpreting what the students were referring to in your focus group?
Yeah, they were talking about the skills that they actually need to succeed in the clinical setting versus what they felt was valued in the undergraduate space. And it was generally that sort of what you know, the knowledge you have, the skill, the clinical skills you have was valued in the undergraduate space. But once they're in the workplace, it was actually things like communication skills that counts. And sort of the basis of achievement there. So it was interesting. They were sort of saying that that literacy that was maybe not perceived to be as valued when they were students was actually incredibly highly valued when it got to the workplace.
Thank you. So the skills emphasis, so what are we covering within the competency literacy? Is on the right-hand side this time. So competency literacy involves modern competencies such as digital literacy, media literacy, and the ability to navigate and utilize various communication technology. Emphasizing understanding the implications of communication in a digital context, including online etiquette and digital and safety. The engagement with the messages, trying to make sense of it and clarify. And it's not just a consumer, but is actively creating and evaluating of content. Whereas your communication skills, your basic skills, is more on the mechanics of how you get your message across. How do you use your words to get your message across? Are we all happy? Just
Yes.
thumbs up. Okay, so what do you think are the key components of communication literacy? So if we have to think about, if we have to teach our students communication literacy, what are the components that we have to include? What do you think? You can add it to the chat. If you want to unmute, you can unmute. So what do you think is the key components of communication literacy that we should be focusing on when we are teaching or designing our teaching or learning engagements? I'm going to start off with active listening. So how do we listen? Are we hearing the message? Are we able to respond to the message? Are we engaging with the message? So active listening for me is one of the components. Sue, yes.
So Lizelle, I don't know if I'm jumping the gun here.
Yeah.
That how we currently do it, if we're looking at what would we include, this whole thing of tick box kind of OSCE stations where people, the scenario of Breaking Bad news, okay, tick, we've done communication, really bothers me, because again, it's very much dependent on theory and then no real life practice. It's like a staged practice. So active listening I like, and
yes,
and the idea of bidirectionality. That I said it before, that not only is somebody speaking, but that you're actually hearing what they're saying, which might not be the words that they're speaking. So there's a big element of interpretation there, I think.
Interpretation. Yes, I like that. I see, Aviva, you've got your hand up. Please join the conversation. Yes.
So it's interesting we're discussing this. There was an ECHO meeting. I'm not sure if it was last week or the week before, and we were discussing communication in terms of counseling skills, teaching counseling skills for students. And the idea that came across was this idea of teaching students to have a conversation rather than that tick box exercise that Shira was referring to. The challenge is that our students don't know how to talk. And the difficulty is, so Elise Archer was just saying, we all started off really rubbish at communication, especially with patients in the very beginning, and maybe the onus is then on us to do more communicating and not follow a tick box exercise, and try and teach students to engage in that conversation and rather use that tick box as a roadmap when they get lost. So my colleague Deirdre always says you use a map when you're lost, and that's what the tick box is, that roadmap. Otherwise, you talk to someone as a person. I don't know if that makes any sense.
Oh,
but...
absolutely. So it speaks to, again, to what Vesna was saying right in the beginning, is that kindness, having the respect and having the openness to engage with somebody. So we talk to one another. It's not just I'm here, I know what I want you to do, and therefore I'm asking questions and then going into what Shira is saying, but I anticipate the answer, so I'm not hearing what the person is saying in front of me. So yes, it's that Lebogang, what you were saying, having the mindfulness and being present, not being busy with something else in your mind. And this is what the digital age is bringing to the fore, is we are multitasking. When we are engaging in an online space, we are not listening and we are not hearing, and therefore the feedback is not there. We are not hearing what we're supposed to be hearing because we are busy with other things. We are not present. We are not seeking clarity. We are not adaptable in making able to adapt to where the conversations is going. And Aviva, I think that is what you are saying. So therefore we are falling back onto the checklist instead of going with the flow, or going where the patient or the engagement with the person is taking you. So that are all very, very important components that needs to be included. So I'm just going to mention, so we mentioned active listening, clarity and conciseness. So what are we trying to say? Are we listening, or because the person is not concise or not clear in what they are wanting to say, we are not hearing or we are not listening? So how do we get the students, or how do we teach them how to phrase their message so that people are able to hear what they are trying to say? Stuart, yes, please.
Just when you're talking about, synthesizing information and then presenting a concise message, one of the things people seem to dread the most in the clinical setting is when they've got to pick up the phone and they've got to call, the radiology consultant and book a scan, or phone the anaesthetist and book a patient for theatre, or book transport or something like that. And that skill seems to be an incredibly challenging one, that ability to synthesize information, be persuasive, and get a clear message across is one of the things that when they're getting their ward work, one of the things they dread the most is that they have to book a CT scan or something, and it's not because they don't have the knowledge, but because the communication skill is sometimes what lets them down.
Absolutely. And having the emotional intelligence, or the confidence of saying that this is my need and I need to get you to accommodate me because of a hierarchy or a power difference, or not understanding the culture of the system that they are engaging in. So yeah, there's lots of things that can be impacting how they communicate. So thank you for that. So emotional intelligence, understanding and managing one's own emotions, as well as recognizing the emotions of others. So you have been talking about the environment, as well as the how to accept the messages earlier on in the beginning. So these are all components that we should be including in or that should be part of a person's ability to say that I'm communicating effectively. based on I am cultural sensitive. I am aware of my own emotions. I am able to produce a concise and clear message. So those are things that we need to build into our learning experiences so our students will be able to develop those skills. So why should we care about teaching communication literacy? And this is literally speaking to what we were talking about, developing effective communication skills. So Stuart, this speaks to what you were saying. They need to be able to know how to communicate, how to get their message across, fostering public speaking, interpersonal communication, and how to make sense with other people. Promote critical thinking and analysis of messages. I think that speaks to what Shira was saying around the decoding and coding of messages. The cultivate social awareness and responsible practices. Anybody think, have an idea of why we should be including that? What does it mean to be cultivate social awareness and responsible communication practices? How does that relate to what we teach and how we communicate?
I
Yes.
didn't raise the hand, but can I pop in?
Yes, please, Vesna, come
Might
join.
just to warn you, Lizelle, the internet might switch off, but there's nothing I can do about it.
No problem.
So when I look at that, that brings me to something that I always say, and that's like faculty culture. What is our culture? How do we want to build our social responsibility towards the students, towards our staff? We can't be having communication literacy built
Yes.
with the staff, but then when it comes to students, it becomes a separate issue, So I think it goes to the root of everything that we've spoken until now, and it builds into faculty culture, you see. And I think it's a very good subject. I see Sarah is also excited to discuss this kind of topic, because the thing is,
yes,
we need to decide what is our responsible practice, as a faculty. And then when we decide that, then we need to build it into our habitual, everyday professional practice. And, my problem is that sometimes we move one step forward and then we basically forget that it's not only about individual, it is about individual, but it's about our community also. So I don't know if I'm coming through, if you understand what I'm saying.
Yes,
but
yes, no, absolutely.
Sarah has raised the hand. I want to hear what she says, Lizelle.
Sarah, please join.
Hi, and apologies for joining late. So
Not a
I
problem.
also, I hope I'm not kind of going back two steps like Vesna was just saying. But I mean, one thing I think about is again, like organizational culture is also the social norms and power dynamics that exist around communication. So I don't work with clinical students so much, but within clinical environments and very hierarchical environments, there are certain norms that are expected, but are often invisible. And being aware of those and aware of what we are cultivating or are seeking to challenge is really important if we also want to create spaces where people will be able to share openly with students if they're patients so that they can listen, or if not just through the words, but body language and so on, we aren't creating an environment that is reinforcing certain kind of power dynamics through the words that we use and the ways that we communicate. So I totally agree with Vesna about these points around teaching communication is not just a set of principles, but it's an enactment of norms and what is sanctioned or what is celebrated. And maybe just along that, when I saw that point, some of the things I thought about in terms of responsible practices are things around, for instance, in clinical settings, what information one shares in a public setting, being aware of who's around,
who might be listening in and what the implications might be of how someone shares in such an environment. So there's some things like that that might be very relevant for students that work in clinical spaces. When asking for something that might disclose a person's status or things like that, just being mindful of some of those I'm not sure what you meant by responsible, but those are some instances that jumped to mind. Thanks.
So, Sarah, you are on the money. So absolutely, we need to think about when we are teaching, when we are creating our learning experiences, these are the things that our students are going to be exposed to in the real world. And if we are not sensitize them to what we say, when we say, and where we say, they are going to be reprimanded, or they might find them in a difficult situation, and then are we helping them then to manage that? And there's so many rules and regulations and the POPIA Act, so we need to be aware of what we're saying and where we're saying it, and who's overhearing it. So absolutely. So we're also speaking about the empowerment of students to communicate effectively, specifically for impersonal, academic, and professional, to reach their personal, academic, and professional goals. But it also speaks to getting them again to how do they or empower them to communicate effectively in our day and age. And it speaks again to what Sarah was saying. When we speak or when we are getting information, how we phrase our questions, having that ability to understand that I am dealing with a patient, are they able to understand me, so that they can communicate in that way? How to navigate plagiarism, and specifically with AI that's available, what is my responsibility regarding other people's views, and how do I get that across, and how do I represent that? So it's just things that we need to think about. And then also navigate media. We've got the internet, and information is so readily available. We need to get our students to understand or navigate fake news, misinformation, or and are those concepts being included in what we are dealing with in our case studies, what we are presenting to our students? So just some thoughts for you to ponder. So communication literacy and health science education, I've listed some areas. Yes, that we can, that's opportunities that we can build in communication literacy, aspects of communication literacy. Yes. Is these things currently happening in our teaching, or is there opportunities for strengthening it, adapting it, changing it? Yes. Who wants to add their thoughts? Yes. And what I mean with crisis communication is, if there is like COVID-19, what information goes where? How do we trust? Who's communicating bad news when it comes to pandemics and all sorts of crisis information that needs to be shared, and how it's been shared, that it's been understood. So patient education, how do we prepare our students to communicate with their patients, giving them education around their health? If society, the level of health literacy in society is not, might be a challenge. I don't know. Is health literacy an issue for us to consider? Yes, Sarah. I think that speaks to your environment.
So I work more in postgraduate training, but my field is social and behavior change communication. But I think whereas I think, unfortunately, many times in clinical settings, there is this sense, and it's replicated, that communication is about educating. as opposed to a two-way conversation. So there are techniques that one can be teaching, such as motivational interviewing, or it's also called healthy conversations and things in clinical settings that have a lot of a much stronger evidence base of getting people to both hear and also identify and act upon information than the knowledge dump that I think, unfortunately, many of us have been trained in, we've received, and then replicate. So that's just one example. Even the word education, it doesn't acknowledge the local insights and knowledges that people have that they're navigating when taking on board information. And that can sometimes help. It doesn't 100% help address health literacy. I think some things are more complicated than others, depending on what you're talking about. But I think there are a range of evidence-based approaches to those kinds of conversations that are out there, that are theory-based, that are vetted. I don't know if they're being taught to our students, but if they aren't, we should be asking why not.
Absolutely. But so it's literally providing, like you were saying, these opportunities when you are dealing with how to give patient education, how do you give information to a patient. There's an opportunity for us to get the students to practice strategies to show the getting to or achieving the competence in communication literacy. Building trust relationship and building rapport with your patients and colleagues and peers. That's another way of practicing and embodiment of communication literacy. Interprofessional collaboration. So how do we engage with other healthcare professionals? Cultural competence, having an understanding of when to say what and what words to use. And then also getting feedback and asking for feedback and not getting emotional. So that's another way of dealing with that. This is my thoughts. So the last little bit, this was literally just the introduction of some aspects to think about when we talk about communication literacy. And I think there's much more to it than what the eye meets. And I think we haven't really engaged with, we've engaged with communication skills and communication and aspects of communication. But myself, I can speak only for myself and I can make an assumption. But for me, I don't think I have really went into facilitating the development of communication literacy in our students or in my students. How do you communicate? How do you make sense? How do you understand and provide opportunities for them to see how they navigate? So I found these quotes around communication. And it speaks to different aspects of communication that can feed into communication literacy. It's multifaceted, it's complex. It's not just a one size fits all or one way of looking at the world. There's different ways of seeing and knowing and how we get our message there. Is there any one of these that speaks to you that you think, you know what, yes, I'm on track. Yes, I am embodying it. Yes, I am moving things forward. So this is my final thought. This is my last slide. So please, any comments, suggestions, any thoughts on what we were discussing today that stood out for you, please. The final word is in your hands. Thank you, Aviva. If you talk to a man in a language he understands, that goes to his head. If you talk to him in his language, that goes to his heart.
I love this one. Can I pop in?
Yes, please,
I
Vesna.
love this one. It's exactly what I was saying about, it's communication is not about only transfer of skills or transfer of information. It's lots more than what we think, I mean, even when you lecture, if you're not touching students and connecting to their minds and the way they feel, they don't actually gain that knowledge in a proper way. And if you're talking to someone and you're just maintaining the professional level that we call, then the information that you're trying to pass through it doesn't go further. And this is what people don't understand.
Yes.
You basically lose, thanks Sarah, my biggest supporter. you lose the you lose the touch with what you are giving outside if you're just communicating in mechanical way. And that again links to how do you relate to your colleagues, to your staff, to students. Do you allow exchange of this information in better way, or do you just limit it to what is mechanical and what is prescribed? And one of the things that I hope that we will nurture in the future is that our education and our faculty, as well as our communication amongst us professionals, and our administrative staff, PSA, will become something more, you know. And I think definition of communication literacy can be defined at the Faculty of Health Sciences as something different in the future, not just what is written and what is expected, but it should become our own culture, better one. That's what I'm thinking of.
Thank you for that, Vesna. And I totally agree. We are so focused on the mechanics that we forget about the message. So yeah, and how the message is being portrayed, which speaks for me, the very first one of Peter Drucker, who said the most important thing in communication is hearing what isn't said. And for me as a health science or as a healthcare professional, is that because patients don't always say what they want to say or need to say, and it's a skill of hearing or reading between the lines or hearing between the what is being said. Anybody else have got some comments, questions, concerns? Yes.
So I'm going to jump in and say that I like the purple one that you've got in the middle, not because it's just purple, but the Pat Macmillan one, where we're acknowledging that this thing takes hard work, but against the backdrop of climate relationship. Vesna was talking about faculty culture, and then the idea that it is a skill and you can practice it, but how do we adjudicate what's coming out of that skill? So I really do like the idea that you can't just say there are good communicators and bad communicators in the world, and that's how the world runs.
Absolutely, because we are all able, we got this far to getting without, and you can't get this far without being able to communicate or getting your message across. But we need to acknowledge that what we are assessing might not be what we expect our students to do. And that brings up a whole other conversation that might not be relevant for today, but it might be something that we need to look at in the future as to are we assessing what we want our students to achieve or be and become in the end. So that's a very valuable input. Thank you.
Sorry, just a thought. Sorry.
No, Sarah, please. No.
I mean, I think it's lovely. And so many of these are talking so much about, who's assessing? I mean, wouldn't it be the people who are trying to hear rather than us as technically sound or the students, I delivered it well, but talking to patients, what did you understand? How well are we communicating? Did you connect? Did you feel respected? Those kinds of things. And I wonder how much, I just don't know because I don't, again, work in this space, but I love your question about are we assessing the right questions? What do we want the end goal to be? But I think sometimes also just saying who's in the right position to assess whether someone's been a good communicator or not. I don't know how you do that, but it's just a thought.
That's a very, very, very good question. And I think we sometimes hide away from engaging with those questions, but I think it's something that we need to start asking and not just accepting, the norm, challenge the status quo. Are we still relevant in today's day? like Eric Monsieur was saying in one of his talks, and Shira will know that I really like what he was saying, but he was asking, are we preparing followers of yesterday or leaders of tomorrow? And it's a question for us as to, what am I in that? Am I a follower of yesterday or am I a leader for tomorrow? And if I'm saying I'm a leader of tomorrow, how do I develop leaders? What do I accept and expect from my students? Or am I just accepting that this is the four walls that I'm working in, and therefore I will just be. But yeah, that's becoming oh, I can't even speak English, so I won't even try. I'm getting my message across. I think you can hear between the sentences that I'm trying to say. So we are 2 minutes before 1. Thank you so much for listening and participating. I really appreciate your sharing your messages and your ideas, because it's what Cicely Tyson was saying there at the end. We don't always know our true value. Yes. But we can't view the world through, we don't measure up. I think we are all measuring up, and everybody has got a valuable point and a valuable insights to share. So thank you for participating and thank you for engaging. I really appreciate that. Next week, Shira is going to take the conversation further with within communication literacy. So we are looking forward, Shira, to listening to you next week.
Yes. Thanks, Lizelle. I think we've really had a great session this time around. You've raised a lot of conversational points, and I think over the next couple of weeks we'll unpack maybe where we're going with it and what we should be doing with it. So looking forward to seeing everybody. Thanks, everybody. Have a great afternoon.